Hello, my name is Angela Kern, and today I would like to share with you my interview with a professional nurse practitioner. Advanced practice nurses are at the forefront of rapid changes taking place within healthcare reform today. As the medical field has been facing a shortage of primary care providers for some time now, advanced practice nurses are able to help alleviate this stress and provide greater availability to care for patients. I had the pleasure of meeting with a family nurse practitioner who has recently began her career in this new role as an advanced practice nurse within a private family practice clinic. Megan Cordy is the second mid-level provider in her current clinical setting, working alongside 5 primary family care providers and a second mid-level physician's assistant. The time I was able to spend with Megan opened my eyes to various aspects of the nurse practitioner role, including her scope of practice within the clinic, as well as how her nursing experience aids her with guidance when faced with ethical dilemmas in her current practice. Megan shared her nursing, educational, and family background with me as we met to discuss her outlook on the nursing profession and the role of the advanced practice nurse. Megan has stayed close to her family roots as she was raised in Clinton County, a neighboring county to St. Clair, where she currently practices as a certified family nurse practitioner. Megan has always been in the healthcare field, practicing as a registered nurse for 11 years, both in intensive care units and urgent care settings. Her educational background includes a Bachelor of Science in Nursing in 2010 from McKendree University, and further advancing through the University of Southern Indiana, in which she obtained a degree of Master's of Science in Nursing in 2014. Upon completion of her curriculum at the University of Southern Indiana, Megan became a certified family nurse practitioner through the American Association of Nurse Practitioners and started her career at Belleville Family Medical Associates as the first family nurse practitioner on their provider staff. Currently, Megan works alongside 5 primary care providers specializing in family practice, as well as a physician's assistant. Megan informed me that she is grateful to have a second mid-level provider within the practice whom she can work closely with and learn from her past experiences. As Megan is certified in family practice, this allows her to provide care to patients of all ages. While practicing in Illinois, Megan does have a collaborative written practice agreement in place with the family practice, which helps guide the care she provides within her scope of practice. Along with treating acute and chronic conditions that patients present to the clinic, Megan has also recently stepped into the role of nutritional counselor within the practice. While speaking with Megan about her role within the family practice, she described to me a typical daily schedule. She informed me that she typically sees anywhere from 12 to 20 patients a day, depending on how busy the rest of the providers are in the office. Megan has had experience with treating both acute conditions as well as maintaining and following up on chronic conditions and long-term medications. She does have the ability to order diagnostic testing such as CT scans and MRIs, as well as refer patients for physical therapy or cardiac testing such as a stress test. 2 days during a week, Megan also takes time out of her schedule to devote to nutritional counseling. She states she enjoys this new role as it allows her to provide more thorough education to patients and to follow their progress throughout the course of treatment. As the nurse practitioner role is fairly new to Megan, she has had only a few occurrences that have challenged the ethical standards that she upholds. By working with patients of all ages, Megan believes that most of her ethical issues arise in the adolescent and young adult age groups as well as the elderly. The reason these age groups stand out the most to her is because with the adolescent and young adults, oftentimes they are still under the care of their parents. This brings up the ethical issue of confidentiality. If an unexpected diagnosis is discovered, the patient, in this case being an adolescent, may request that the information stay confidential between themselves and Megan and not shared with the patient. Megan finds this difficult to follow at times, as she is a mother herself, that she is just trying to keep the patient safe and do what is best for them. Megan states that sometimes she does not agree with keeping medical conditions from the parents, but she has to maintain the patient-provider confidentiality agreement that is in place. The other age group that Megan finds to present ethical dilemmas often is that of the elderly population. This is in part due to an elderly patient unable to care for themselves, therefore relying on their adult children to care for them. Megan shared an instance with me in that when an elderly patient frequently meets with her, accompanied by her grown son, oftentimes has dirty clothes on, unkempt hair, and dirty hands. When Megan addresses her concerns with the son states that he does the best he can for his mother in keeping her clean, fed, and in a safe environment. In this scenario, Megan oftentimes wonders if a care facility would be best for the patient, but she has troubles addressing this with the family members. She does not want to make it sound like the children are unfit caregivers, but at the same time, she believes that the patient would receive the greatest care in a full-time facility. In conclusion, I found my time interviewing Megan to be very informative. It helped me gain a greater understanding of the daily tasks of a nurse practitioner in a family clinic, as well as another area in which teaching is focused on through her time spent as a nutritional counselor. As I continue through the education for advanced practice nursing, I will continue to relate my experiences to that of Megan's and to remember when ethical and legal issues arise to always keep the patient's best interest at the center of my actions.